Today I'm going to be talking about dental hygienist's own practice. The agenda will be introduction, origin, scope of practice, impact on dental access, diversity in the dental field, future of oral health care, and last references. Introduction. Dental hygienists are essential members of the dental care team, improving dental care for their patients. The profession is now breaking new grounds by opening their own independent practices. This shift represents a pivotal moment in oral health care and expanding the careers of dental hygienists. Allowing dental hygienists to open their own practice independently from dentists can help expand dental access to the community. Origin. According to the American Dental Hygienist Association, the passage of statute in 1987, Colorado became the first state to allow licensed, experienced dental hygienists to open independent practices. As of 2021, there are 42 states that allow direct access hygiene. Each state's Dental Practice Act will determine the supervisory level for dental hygienists seeking to provide dental services as an independent hygienist. The collaboration with a supervising dentist and the type of collaboration is a necessary consideration for the solo hygienist. Some states will allow preventative dental care without on-site supervision by a collaborating dentist. Other states will allow an independent hygienist to provide a full range of services. Scope of practice. The ADHA states that Colorado allows licensed dental hygienists to provide dental hygiene diagnosis, radiographs, remove deposits, accretions and stains, curettage without anesthesia, apply fluorides and other recognized preventative agents, topical anesthetics, oral inspections, and charting. Local anesthesia requires general supervision in the state of Colorado. When a problem is suspected, the patient is referred out to the dentist. Allowing dental hygienists to open independent hygiene practices can have several potential benefits, both for dental hygienists themselves and for the broader healthcare system. The specific scope of practice requirements can vary depending on the area, so it is essential to check with the local jurisdictions for the most up-to-date information. Impact on dental access. 1. Increased access to dental care. One of the primary advantages is improved access to dental care, especially in underserved or rural areas where there may be a shortage of dentists. 2. Cost-effective care. Dental hygienists typically focus on preventative care such as cleanings, screenings, and education. By providing these services, they can prevent dental issues from becoming more severe, ultimately saving patients money in the long run. Early detection and prevention. Dental hygienists are trained to identify early signs of dental problems, including cavities and gum disease. Catching these issues early can lead to more effective and less invasive treatments, improving overall oral health outcomes. 4. Patient education. Dental hygienists often spend more time with patients than dentists do, allowing for a more comprehensive patient education. Efficacy and convenience. Independent dental hygiene practice can offer flexible scheduling and shorter appointment times, making it easier for patients to access care and fit appointments into their busy lives. Supporting the dental team. Independent dental hygiene practices can work collaboratively with dentists and other healthcare providers, helping to streamline the dental care process and ensure that patients receive comprehensive care when needed. 7. Entrepreneur opportunities. Allowing dental hygienists to open their own practices can create entrepreneurship opportunities in the healthcare field. This can lead to increased job satisfaction and career advancement for dental hygienists. The Census Bureau in 2019 shows the racial and ethnic backgrounds of dental hygienists. This graph right here shows an overall demographic in the dental hygienist job and in the dental field in general. The white population is probably the highest, so having more diversity within the job is very crucial and better for the future. Steps to improve diversity in dentistry. Learn. Start your lifelong learning journey by making a commitment to educate yourself. Don't rely on those around you to spoon-feed you readily available data. Read books and journal articles about race, diversity, and oral health. Watch documentaries and listen to podcasts. There are so much information out there that can help understand and ground anyone with empathy. 2. Reflect. Learning about race is hard. It can be emotional, isolating, and discouraging. Race is not just a national issue. Global systems and hierarchies have been created around the social structure of race. Take the time to be honest with yourself, dig deep, ask hard questions, and heal from your own life experiences. 3. Do. Act in your community. This will be different depending on where you live, the patients you serve, and the colleagues in your network. Once we know better, we must do better. This could be contributing to health programs in a marginalized community, encouraging your alma mater to increase their student body diversity, or helping your office recruit and promote hygienists from diverse backgrounds. It also means not expecting hygienists of color to work for free, teaching about diversity without proper compensation, or solve large inequalities without the help of white hygienists. How can you leverage your network and resources to create representation on communities within faulty positions or on your own clinical team? The future of oral health care. Exploring trailblazers. In the forefront of this revolution are states like Colorado and Washington. Colorado, for instance, has allowed dental hygienists to own their own practice since 1986. These states have a set precedent demonstrating the feasibility and benefit of such models. Impact data. Statistics from these pioneering states are telling. In Colorado, over 30% of dental hygienists-owned practices cater to rural or underserved populations, a significant contribution to public health. States with progressive dental laws. The reformed leaders. States like New Mexico and Maine have recently updated their laws, allowing greater autonomy for dental hygienists. These changes often come after persistent advocacy and are driven by the need to expand dental care access. Visuals and anecdotes. An infographic illustrating Maine's legislative journey from restrictive to progressive dental law vividly shows the shift towards more inclusive healthcare models. States with restrictive practices. The tight grip. Conversely, states like Alabama and Mississippi maintain stringent laws. In these regions, dental hygienists face significant barriers to practice ownership, tethering them tightly to dentist-led models. Comparative analysis. A side-by-side comparison with progressive states underscores the disparities in healthcare delivery models and their potential impact on public health. States on the cusps of change. almost there. Texas and Florida are currently reviewing their dental practice laws. Proposals under consideration could open new opportunities for dental hygienists in this populous states. Insider quotes. Quotes from lawmakers and healthcare advocates in these states provide a window into the ongoing debates and the potential for future change. The economic impact of hygienist-owned practices. Financial perspective. Economically, hygienist-owned practices often operate with lower overheads, making dental care more affordable. This model can stimulate local economies and provide cost-effective care. Case studies. Success stories like a hygienist-owned clinic in rural Oregon that significantly reduces cavity rates in the community illustrates a tangible benefit of this model. Patient care and community impact. Healthcare benefits. These practices often prioritize preventative care, leading to better overall oral health in the communities they serve. Patient testimonies. Stories from patients who've received care in these settings highlight the personalized attention and increased accessibility that these practices offer. This exploration into state law governing dental hygienist practice ownership reveals a complex but evolving landscape. From pioneering states setting a precedent to those on the cusps of legislative change, the movement toward hygienist-owned practices is gaining momentum. Thank you for listening to my PowerPoint.